Yeah, and Dr. Eyolfson, sorry about that.
No worries. Thank you, Mr. Chair. Thank you all for coming. Now, one of the things we've been aware of, this was brought up by a number of people at a town hall I held on the subject of cannabis a couple of weeks ago. And this parallels an experience in the United States as well, that a lot of our current drug laws, the criminalization of drugs, including cannabis, has particularly affected groups that are overrepresented already in the justice system and are already subject to poverty and other issues. And in Canada, that includes our First Nations population. Now, do you find that, and I put this to everyone here, that our current criminalization strategy is unfairly or overtly targeting Indigenous groups? Would you say they're overrepresented of those that are being disadvantaged by this? Mr. Day, I'll start with you. Okay,
so thank you for the question. Speaking to the issue of overrepresentation, whether it be in the child welfare system, the criminal justice system, and so on and so forth, we know for sure that we sometimes see society address the surface issues. And we know for sure when it comes to addiction is only a surface issue. My friend and colleague next to me talked to the social determinants on health. And, in my remarks, I spoke to the issue of needing to have effective funding in policing. Because from an overall systems perspective, we know for sure there are deeper issues, and that the cannabis issues and the criminalization over the last several decades has only spoken, to the fact there are deeper issues. So my point being that there will need to be an examination of what are at the core of issues of addiction in the community, because we can send good money after bad here on this issue. But if we're not addressing the core issues in our First Nation communities, we'll always be, putting money where it's not going to be best used.
Mm-hmm. Thank you. Now, one of the things we've heard in our testimony, and I found in my own experience as a physician as well, is that that there are many people who, there's a correlation between mental illness and drug addiction, and we do know that there are many people who suffer from mental illness that then go on to experiment with drugs, self-medicate with drugs, consequently become addicted to drugs, which causes its own problem, which also will actually make treatment of the underlying mental illness worse, and it becomes quite a challenge and a bit of a vicious cycle with people from all populations, not just Indigenous population. But in regards to the Indigenous population, the Government of Canada has made some substantial funding commitments over the next few years, again, in mental health for non-Indigenous as well as Indigenous people. And right now we're, as part of a commitment, is almost $120 million for mental health for Indigenous people over the next 5 years. Do you believe that will help address one of these roots of the problems that is helping, that are getting people in First Nations groups or in Indigenous groups into problems with drugs? I'll allow everyone on the panel to answer that.
Yeah, thank you for that. And I'm glad you switched to Indigenous and not just First Nations.
Yes, that was my mistake.
Thank you very much. That mental health is a big issue, and the funding, and we're looking forward to working with the federal government on funding for Métis, which we've never really had before. Mm-hmm. Drug use and mental issues and health issues in our Métis communities, and suicide amongst our youth in all our Métis communities is a huge problem for us. Mm-hmm. It's something that that's why the funding is so important for us to have the resources to have so we have better care for our Métis people in these communities and in our urban centers, because these are huge problems for us, and the cannabis issue is just a part of that. because, like you said, mental health and drug addiction is a big problem for Métis people and all Indigenous people.
Yes, sir.
Thank you. This is a good question. So can you just give me the simple one line of your question so I can answer it directly?
The commitment we're making to
Yes.
vastly improve
120.
mental health funding, do you think that is going to help address this and help prevent some of these people from the Indigenous communities from becoming exposed and addicted to drugs in the first place?
Great. That's a really good question, and I do want to make the delineation here between Indigenous and First Nation, because I think it's an important one, as my friend and colleague to the next to me stated. And I must state that when it comes to First Nation health, under Health Canada, we have the First Nation Inuit Health Branch. And there's a program that deals specifically with First Nations, and the larger extent of suicide issues, social problems that have been in the media are largely focused on First Nation communities. And I must say that there's an underlying thread and commonality of what some of the main issue is. It's jurisdiction and governance of health. Let me point to that specifically. It will be very important for this committee to recognize the issues and implications of cannabis on First Nation governments. As First Nation health authorities and the governance becomes more developed, you will find that when it comes to communities and territories that have a handle on the governance, that have control and authority within their community and their catchment and for their citizens, they are able to provide better health outcomes. I just attended a former community called Hobima, Samson Cree First Nation, and they have 4 communities that have a health system that have an integrated model where they have a handle on their governance and they have a direct relationship with Canada. So my point being that it's not just the money coming in and the service being provided, but it will be ultimately the governance and authority of those First Nation communities to take an active role and responsibility in addressing the addiction problems in the community.
Your time's up.